If you're blood type O, what I'm about to share could literally save your life. There are 7 specific infections that target people with your blood type more aggressively than others, and most people have no idea this connection even exists. But here's the thing. Once you understand why this happens and what you can do about it, you'll actually be better protected than most people walking around completely unaware of these hidden risks. Before we dive into these potentially life-saving details, I'd love to know where you're joining me from today. Drop a comment below and let me know if you're blood type O or if this information might help someone you care about. And don't forget to hit that subscribe button and turn on notifications, because at Health Factor, we believe knowledge is your most powerful tool for staying healthy. Welcome to what might be one of the most important conversations you'll have about your health this year. If you're among the 45% of people with blood type O, your immune system has some fascinating characteristics that make you unique, both in terms of vulnerabilities and surprising strengths. Your blood type isn't just about medical emergencies or blood donations. It's actually a blueprint for how your immune system recognizes friends from foes, how bacteria and viruses interact with your cells, and why certain infections seem to target you while others barely touch you. Understanding these patterns isn't meant to worry you, quite the opposite. It's meant to empower you with knowledge so you can take targeted steps to strengthen your natural defenses and stay healthier throughout your life. Think of it like having a personalized security system manual for your body. Research shows that people with different blood types face different infection risks, and blood type O individuals have some unique challenges we need to address. But here's what's encouraging. Once you know what to watch for and how to protect yourself, you can actually turn this knowledge into a powerful advantage. Let me explain why your blood type O makes such a difference in simple terms that will help everything else make perfect sense. Your blood type is determined by specific proteins called antigens that sit on the surface of your red blood cells. If you're type O, you don't have A or B antigens. Your cells are essentially bare in this regard. While this might sound like you're missing something, it's actually your body's original design. Here's where it gets interesting for infections. Many bacteria and viruses have evolved to attach to specific antigens on our cells. Think of it like a lock and key system. Some pathogens have keys that fit perfectly into the locks on type O cells, while others are looking for the A or B antigens you don't have. This creates a fascinating pattern. You're more susceptible to infections that specifically target cells without A and B antigens, but you're actually protected from infections that need those antigens to gain entry into your cells. Your type O blood also influences your immune system in other ways. You tend to have higher levels of certain inflammatory responses, which can be both protective and problematic depending on the situation. You also have different clotting factors and wound healing patterns that affect how your body responds to injury and infection. Understanding this biological reality isn't about accepting limitations. It's about working strategically with your body's natural tendencies to maximize your health and longevity. Infection number 1. H. pylori and stomach ulcers. The first infection that disproportionately affects blood type O individuals is H. pylori, the bacteria responsible for most stomach ulcers. Research shows that people with type O blood are significantly more likely to develop H. pylori infections and the painful ulcers that can result. Why does this happen? H. pylori bacteria have a particular affinity for binding to cells that lack A and B antigens, exactly like your type O cells. These bacteria can attach more easily to your stomach lining, establish colonies, and cause inflammation that leads to ulcers. The early warning signs you shouldn't ignore include persistent stomach pain that gets worse when your stomach is empty, bloating and fullness after eating small amounts, frequent heartburn or acid reflux, and unexplained nausea, especially in the morning. Here's how to protect your digestive system. Focus on foods that naturally fight H. pylori, including fresh garlic, which contains compounds that can inhibit bacterial growth, green tea with its powerful antioxidants, broccoli, and broccoli sprouts containing sulforaphane, and fermented foods that support healthy gut bacteria. Avoid foods that can irritate your stomach lining and make H. pylori infections worse. This includes excessive spicy foods, regular alcohol consumption, and prolonged use of NSAIDs like ibuprofen without food. If you experience persistent stomach symptoms lasting more than a few weeks, don't ignore them. A simple breath test or stool test can detect H. pylori, and treatment with appropriate antibiotics is highly effective when caught early. Infection number 2. Cholera and foodborne illnesses. Blood type O individuals face increased risk from cholera and certain other foodborne pathogens, particularly when traveling to areas where these infections are more common. The cholera bacteria bind more readily to type O cells in the intestinal tract, potentially leading to more severe illness. This knowledge is especially important if you love to travel or frequently eat at restaurants. While cholera is rare in developed countries, other foodborne pathogens that preferentially affect type O individuals are more common than you might think. Your defense strategy starts with smart eating practices. When traveling, stick to bottled or properly purified water. Avoid raw or undercooked foods, especially seafood and eggs. Choose hot, freshly cooked meals over buffet foods, and be cautious with fresh fruits and vegetables unless you can peel them yourself. At home, practice excellent food safety by washing hands thoroughly before eating or food preparation, keeping raw and cooked foods separate, cooking foods to appropriate temperatures, and refrigerating leftovers promptly. Consider supporting your digestive system with probiotics, especially when traveling or after taking antibiotics. Look for supplements containing multiple strains of beneficial bacteria or include fermented foods like kefir, yogurt with live cultures, and fermented vegetables in your regular diet. Building digestive resilience also means maintaining good stomach acid levels, which help kill harmful bacteria before they can establish infections. Avoid overusing antacids unless medically necessary, and consider digestive enzymes if you frequently experience bloating or indigestion. Infection number 3. Norovirus. If you've ever had norovirus, that miserable stomach bug that causes violent vomiting and diarrhea, you might have noticed it hit you harder than others around you. This isn't your imagination. Blood type O individuals often experience more severe norovirus symptoms and longer recovery times. The virus binds more effectively to type O cells, allowing it to establish a stronger foothold in your digestive system. This means more intense symptoms and potentially longer illness duration compared to people with other blood types. Prevention is absolutely crucial since there's no specific treatment for norovirus once you have it. Focus on meticulous hand hygiene. Wash hands with soap and water for at least 20 seconds, especially after using the bathroom, before eating, and after being in public spaces. Alcohol-based hand sanitizers are less effective against norovirus, so soap and water are your best defense. When someone in your household has norovirus, disinfect surfaces with bleach-based cleaners. Wash contaminated clothing and linens in hot water, and avoid sharing food, drinks, or eating utensils. Supporting your immune system year-round can help reduce severity if you do get infected. This includes getting adequate sleep. Aim for 7 to 9 hours nightly, managing stress through relaxation techniques or exercise, eating a diet rich in immune-supporting nutrients like vitamin C and zinc, and staying well hydrated. If you do contract norovirus, focus on preventing dehydration by sipping small amounts of clear fluids frequently, using oral rehydration solutions if available, and seeking medical care if you can't keep fluids down for more than 24 hours. Infection number 4. Certain pneumonia strains. Your blood type O also influences your susceptibility to specific strains of pneumonia-causing bacteria. These pathogens can bind more readily to your respiratory tissues, potentially leading to more severe respiratory infections. This doesn't mean you're destined to get pneumonia, but it does mean you should be extra vigilant about respiratory health, especially during cold and flu season or if you have other risk factors like advanced age or chronic conditions. Supporting your lung health starts with not smoking. If you currently smoke, quitting is the single most important thing you can do for your respiratory system. Regular exercise helps keep your lungs strong and efficient. Even gentle activities like walking or swimming make a difference. Stay up to date with recommended vaccinations, including annual flu shots and pneumonia vaccines, as recommended by your healthcare provider. These are especially important for blood type O individuals given your increased susceptibility. Practice good respiratory hygiene by covering coughs and sneezes, avoiding close contact with people who are obviously ill, and washing hands frequently during illness season. Pay attention to early warning signs that shouldn't be ignored. Persistent cough lasting more than a few days, difficulty breathing or shortness of breath, chest pain that worsens with breathing or coughing, and fever combined with respiratory symptoms. Consider breathing exercises or techniques like pursed lip breathing to help keep your lungs healthy and improve oxygen exchange efficiency. Infection number 5. Skin and wound infections. Blood type O individuals may experience slower wound healing and increased susceptibility to certain skin infections. This is related to differences in blood clotting factors and immune response patterns that affect how your body repairs damaged tissues. Understanding this means being extra careful with wound care and skin health. Clean any cuts or scrapes immediately with soap and water. Apply antibiotic ointment if recommended by your healthcare provider, and keep wounds covered with clean, dry bandages until healed. Watch for signs of infection, including increased redness around the wound, warmth or heat at the injury site, pus or unusual discharge, red streaking extending from the wound, and increased pain rather than gradual improvement. Support your body's healing processes through nutrition by eating plenty of protein for tissue repair, vitamin C for collagen formation, zinc for immune function and healing, and vitamin A for skin cell regeneration. Keep your skin healthy overall by moisturizing regularly to prevent cracks and fissures, avoiding harsh soaps that strip natural protective oils, and protecting your skin from excessive sun exposure. If you have diabetes or other conditions that affect circulation, be especially vigilant about foot care and inspect your skin daily for any changes or injuries that might need attention.
Infection number 6. Urinary tract infections. The connection between blood type O and increased UTI risk is particularly notable in women, though men can also be affected. Certain bacteria that cause urinary tract infections bind more readily to type O cells in the urinary system. Prevention strategies are especially important given this increased susceptibility. Stay well hydrated by drinking plenty of water throughout the day. Aim for pale yellow urine as a hydration indicator. Urinate frequently and don't delay when you feel the urge. Practice good hygiene by wiping from front to back after using the bathroom, urinating before and after sexual activity, and avoiding harsh soaps or douches that can disrupt natural bacterial balance. Cranberry products may be helpful for some people, though the evidence is mixed. If you choose to use cranberry supplements, look for products standardized for proanthocyanidin content. Consider probiotics that support urinary tract health, particularly those containing lactobacillus strains that help maintain healthy bacterial balance in the urogenital area. Recognize UTI symptoms early: burning sensation during urination, frequent urge to urinate with small amounts, cloudy or strong-smelling urine, pelvic pain in women, and fever if the infection spreads to the kidneys. Don't ignore recurring UTIs. They may indicate underlying issues that need medical evaluation and treatment. Infection number 7. Certain parasitic infections. Blood type O individuals face increased risk from specific parasitic infections, particularly when traveling to tropical or subtropical regions where these parasites are endemic. Understanding this risk helps you travel safely while maintaining your sense of adventure. The key parasites of concern include certain malaria strains that show preference for type O blood cells, some intestinal parasites that bind more readily to type O cells, and specific tropical infections transmitted through insect bites or contaminated water. Pre-travel preparation is crucial. Consult a travel medicine specialist 4 to 6 weeks before departure, especially for destinations in Africa, Asia, or Central/South America. Follow recommended malaria prophylaxis if traveling to endemic areas, and ensure all routine vaccinations are current. Protect yourself from insect-borne infections by using EPA-approved insect repellents containing DEET, permethrin, or picaridin, wearing long sleeves and pants during peak mosquito hours, and sleeping under bed nets in areas with malaria risk. Practice strict water and food safety in developing countries by drinking only bottled or properly purified water, avoiding ice in drinks, choosing hot, freshly cooked foods, and avoiding raw fruits and vegetables unless you can peel them yourself. Watch for symptoms after travel, including persistent fever, unusual fatigue, digestive symptoms, or skin changes, and inform healthcare providers about your travel history and blood type O status when seeking care. Building your immune defense system. Now that you understand your specific vulnerabilities, let's focus on building robust defenses tailored to your blood type O characteristics. Your nutrition strategy should emphasize immune-supporting foods that work particularly well with type O metabolism. Focus on high-quality lean proteins like grass-fed beef, wild-caught fish, and organic poultry, which provide essential amino acids for immune system function. Include plenty of immune-boosting vegetables, particularly dark leafy greens rich in vitamins A and C, cruciferous vegetables like broccoli and Brussels sprouts, and colorful vegetables that provide diverse antioxidants. Don't overlook the power of specific immune-supporting nutrients. Vitamin D is crucial. Aim for 1,000 to 2,000 IU daily, or get your blood levels tested. Zinc supports immune function and wound healing. Vitamin C helps with infection resistance, and omega-3 fatty acids help manage inflammation. Exercise is particularly beneficial for type O immune function. Your blood type typically responds well to more vigorous exercise, so include both cardiovascular activities and strength training in your routine. Even 30 minutes of brisk walking daily can significantly boost immune function. Stress management is crucial because chronic stress suppresses immune function. Find stress reduction techniques that work for you, whether it's meditation, yoga, deep breathing exercises, or spending time in nature. Sleep quality directly impacts immune function. Aim for 7 to 9 hours of quality sleep nightly. Maintain consistent sleep and wake times, and create a sleep-friendly environment that's cool, dark, and quiet. Knowing when to seek professional medical care is crucial for blood type O individuals given your specific infection susceptibilities. Don't ignore these warning signs. Seek immediate medical attention for high fever, over 101 degrees Fahrenheit, lasting more than 24 hours, severe abdominal pain with vomiting, difficulty breathing or chest pain, signs of severe dehydration, and any wound showing signs of serious infection. For less urgent but concerning symptoms, schedule medical care within a few days for persistent digestive symptoms lasting more than a week, recurring infections in the same area, unusual fatigue combined with other symptoms, and any symptoms that worsen despite home care. When communicating with healthcare providers, mention your blood type O status and ask if it's relevant to your symptoms or treatment plan. Many healthcare providers aren't fully aware of blood type-specific infection risks, so your advocacy can lead to better care. Keep a health journal documenting symptoms, triggers, and patterns. This information can be invaluable for healthcare providers in identifying connections between your blood type and health challenges. Don't hesitate to seek second opinions for recurring health issues, especially infections that seem unusually severe or frequent compared to others around you. If you found this information empowering, please hit that like button and share it with anyone you care about who might benefit. Drop a comment below letting me know which tip you found most surprising or helpful. Remember to subscribe and turn on notifications so you never miss our evidence-based health insights.